Hey friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. I've been intrigued over this whole COVID thing with one particular aspect, well, many, of course, but this one in particular about the withholding of treatment for people that go to their medical doctor, urgent care, ER with symptoms of COVID, and simple treatments, even medications, are completely withheld with no treatment, even at home treatment recommended. um it's just crazy. When can you remember a time where you went to a medical doctor for anything and they didn't have you leave with a little white slip of paper with scribble on it for a prescription, or they didn't call something in? I mean, there's always something. So the fact that for nearly 2 years now, treatment has been withheld, medications, at home recommendations, anything is just crazy. I recall, and this is why it's a disconnect for me. I recall an article in the early 2000s from the British Medical Journal. It was about children with ear infections. And the article was discussing withholding ear infection or withholding antibiotics from children with ear infections for at least 6 weeks. I know the mommies out there that have the screaming child with painful ears. That's not, doesn't sound like a great idea. But the reason why they recommended this to the pediatricians was that the overuse of antibiotics had caused bacteria to become smarter than us. It caused the evolution of bacteria to accelerate. That's how we ended up with antibiotic resistant strains, for instance, MRSA, where the antibiotics themselves selected out the strongest bacteria that were resistant to the antibiotics, and therefore no antibiotics would work on it. That's how we did that. It was the overuse of for years of antibiotics. But if a mommy was in the conventional medical office with a screaming child with an ear infection, the doctor felt the need to do something. Now, follow this up with another article I recall from probably 15 years ago, where when medical doctors were questioned about their interactions with patients in the office, very often they prescribed a medication not because it was absolutely needed, but they thought that the patient wanted something. And that's what they had. Now, granted, the British Medical Journal is a huge article that carried a lot of weight with it through the pediatric associations here in the United States. That second article about why would a doctor just continually prescribe antibiotics or anything else for that matter is because the patient's sitting there and they're there for a reason. And that's what they have to do. Contrast that to the last 2 years, 2020, 2021, when simple vitamin D, vitamin C, zinc, quercetin, which can be gotten at any drugstore, any chain store, on the internet, easy to take, no side effects, yet that information was withheld. Where drugs that have been used for decades safely, and whether they worked great or worked a little bit, maybe it was a placebo effect, who cares? It was something. Why were they doing nothing? And as we have come to learn, it is early intervention with COVID that helps the most. If you get my COVID favorites, make sure to go to www.drnancy.health. You can download my COVID favorites. It's what you need to have on hand right now when you're feeling well, so that you have it in case somebody around you becomes ill, you don't feel well. And the things that I have on those lists are good for any virus. So you don't have to wait for a diagnosis to start taking them. No, take them right away. And I even have a lot of my patients that are taking those things as a preventative, maybe not daily, but maybe weekly or biweekly. So be sure to go to Dr. Nancy, www.drnancy.health, and download your list. So I think it's been a great disservice to the people of the world, and certainly the people of the United States, that um, what they counted on for their medical doctor to do, and that was to recommend something, wasn't done at all. So I know that we've lost some of our faith in the conventional medical model, and maybe it's about time, because there's been a trend of over prescribing for many years, for generations now. And it does need to stop. There's a better way out there, and I can help you find it. So I hope you're well. Uh, turn off the news and go hug your neighbor.